Bacchero, a board member. If you joined us earlier today at 9 a.m., you would know that we just announced that Mr. Bill Taranto, president and founder of the Merck Global Health Innovation Fund, was just named to be the chairman of the HitLab Breakthrough Alliance. So again, very exciting stuff coming out of Cornell Tech. Thank you again, Dr. Gomez-Bacchero. It is our sincere and genuine pleasure to have you with us here today. Thank you again.
Thank you, everybody. Take care.
Now, it is my great pleasure to introduce the next panel, which is actually very near and dear to my heart. Overcoming red flags with green, leveraging health information technologies to increase nature-based care solutions. I am very honored and very proud to introduce our next panel, Milagros Elia, who is the founder of Elia Wellness, MP at Adult Health, a company that partners with larger hospital organizations interested in developing innovative programs around the green space healthcare initiatives that support the needs of patients, healthcare workers, and the communities to which they belong. Joining Milagros will be Dr. Courtney Schultz, the Executive Director of Health and Technology Partners, a social science research consultancy. With over a decade of experience, she has developed an expertise in the design and execution of behavioral research across the lifespan, specifically for improved health outcomes. Dr. Schultz is an adjunct faculty for the University of Missouri, the research fellow for the Park RX America, and sits on the advisory council for SHIFT Emerging Leaders program. Please join me now in welcoming this tremendous panel. Thank you both for joining us here today.
Thank you, Justin. It's a pleasure to be here.
I'll hand it over to you. Please go ahead and get started.
Wonderful. Well, thank you all for joining us. We're extremely excited to be here today, presenting on our topic. And so we have a little bit of a take on this idea of how to overcome all those red flags you might be seeing in the electronic medical record and approaching it with a novel idea. That idea is approaching it with nature. And so one of the things that we often talk about is this idea of health. But what is health exactly? And it's useful to really start here by thinking about health in a complex way. So we know that health isn't just the absence of disease or infirmity, but it's a state of complete physical, mental, and social well-being. And so when we think about how we achieve that, it's actually rather quite difficult to achieve health in today's world. And in part, we find that healthcare and achieving health is one of those wicked problems. This is an idea that was coined by two researchers back in the 1970s that looks at this idea that problems that are so difficult or impossible to solve because of incomplete, contradictory, and changing requirements are often really difficult to recognize. And that creates an opportunity for a lot of creativity, but it also makes it very difficult to create these solutions. And so one of those famous examples of a wicked problem is climate change. And when we think about the impact of climate change on health, we know that by the year 2030, there'll be 250,000 additional deaths due to climate change at a cost of $2 to $4 billion per year. When we really begin to look at this idea of climate change, we see that there are a number of different pathways that lead to health outcomes. Climate change is an impact on both direct health impacts and indirect impacts. And a lot of this comes from different things. Changes in the primary environmental and social spheres as a result of climate change will have a lot of these negative impacts on health. It will also result in things like shortages and changes around fresh water and food, all of this creating a cascading effect that's only going to make an overburdened health system even more at loss with how to really solve these issues. And this comes on the back of a long legacy here in the United States of a spending mismatch. We know health determinants really lead to certain health outcomes, but when we look at what those individual health determinants are, they don't necessarily match up with spending. So for instance, an individual's access to care only predicts 6% of their individual health outcomes. Yet here in the United States, we spend almost 90% of our national health expenditures on medical services. When we begin to look at this mismatch, things like healthy behaviors are only being spent 9% on. And so when we look at this collectively, at what these individuals' determinants of health are, 59% of an individual's health determinants could be positively influenced by nature-based health interventions. But in order to do that, we have to think about, well, how do we begin to get nature into the healthcare system? And one of the models that we use in conceptualizing this is going back to a salutogenesis approach. Traditionally in the United States within healthcare, we see this as a pathogenic orientation, right? This idea that we're going to focus on medical interventions. It's that fee-for-service model. We cure a person. It's very disease-centric. It often isn't patient-centric. But moving into a salutogenic orientation, we look beyond just the individual. We look beyond just paying for a cure, and we will begin to integrate things like the natural environment. And we bring prioritization to improving then the natural and built environment for those positive health outcomes. We begin to see a commitment to local capacity building. We begin acting to promote causes of health. We begin to focus on knowledge development and learning. We begin to prioritize the normalization of self-reliance and public health outlooks rather than an idea of entitlement. And overall, this shift in healthcare services really begins to integrate this holistic approach to health, wellness, and prosperity rather than just fixing discrete parts of a system. And this becomes incredibly important when we begin to think about what health relies upon. We've known for almost 30 years, according to the World Health Organization, that health depends on our ability to understand and manage the interaction between human activities and the physical and biological environment. And sadly, so often those physical and biological environments are often left out of the healthcare equation. And this has led to, in the last 10 to 15 years, an emergence internationally and here in the United States of these nature-based health behavior interventions. What are those exactly? Well, maybe you've flipped open the New York Times or Outside magazine and seen talk about things like park prescriptions or outside prescriptions. It's this entire concept of intentionally linking nature exposure, so individuals spending time engaged with natural elements, the outdoors, parks, blue spaces, all these wonderful, healthy environments, and intentionally linking exposure to those environments with the healthcare community for improved mental and physical well-being for patients and for staff as a way of reconnecting our entire society around the concept of biophilia, knowing that we have this innate link as human beings to nature, and that we know from self-determination theory that by building upon that, we get satisfaction by being engaged in the environment, and by those connections we get both with other human beings and the environment itself. And so building on those premises then of nature-based health behavior interventions, we've seen an emergence of literature over the last 10 to 15 years again. And this emergence has really been what we call the nature health link. And so what we're seeing is really where the health benefits of nature exposure come from. It begins by that nature exposure contact, time in nature, views of nature, the traditional study back in the 1980s that really showed that even a view of nature from a hospital recovery room meant that those patients recovered faster with less medication than those who had a view of a brick wall. So we know that having contact, seeing, engaging with nature, but it really has the magic when it has those active ingredients. When human beings are exposed to things like fontainside, which are the aerosols released by trees in the forest, negative air ions, natural sights and sounds, all of this triggers within our bodies a response physiologically, psychologically, and manifests in behaviors and conditions. And so what we see then as a result of being exposed to these different environments is that we get things like normalization of blood glucose levels. We get attention restoration. We see improvements in immune function. We see physical activity increase, which has multiple positive outcomes for us, all sorts of epidemics. But most of all, what we see from this growing list of evidence experiences is that nature has an opportunity to contribute both in terms of health promotion and disease prevention. But there's a need. There's many gaps in that literature of exactly how to do this, what the dosage is, and what way we can mechanize the technology of nature to really be targeted on how we help with our patients and our healthcare staff. And so all of this in terms of a setup of what this means in terms of connection of nature and health leads us to this question of really how do we begin to tie this into the idea of health information technologies? And to answer that, I will turn this over to my fellow co-host and presenter to address that question. Millie. Millie, I think you're still muted.
Apologies. Thank you, Dr. Schultz. My name is Milagros Elia, and I am an adult nurse practitioner. I've been a nurse practitioner since 2001, always working majority of my time in a clinical setting. So I'm very aware of the clinical workflow and billing systems. More recently, I've turned towards the community. And during COVID-19, a lot more of my work has been focused on nature-based care activities. With quarantine and isolation, we've seen the spike in mental health issues evolving or spiking in depression and anxiety. Children are having nature deficit syndromes. They are being and with winter, it's getting worse. One thing I want to invite you to do today is begin to look at the nature interventions that we speak of, not just as your park area or your backyard, but I invite you to think of it as a physical determinant to social determinants of health. So here in the United States, where I reside, and Dr. Schultz does as well, we have the Healthy People, Healthy Nations prerogative by the government. And even this year, 2020, their report has listed green spaces as part of the physical determinants to social determinants of health. Now, why do I keep saying social determinants of health? Because this year, and in very recent years that have passed, this is becoming more and more and more of a highlighted aspect of our healthcare. So if you can change the slide, Dr. Schultz, thank you. So when we're looking at our healthcare system from the view of the clinic practitioner, the social needs determinant is this. We do a screening process for everything, right? But if we're looking at social needs, we're beginning to recognize that this plays a big factor in outpatient outcomes. And we're looking at how do we assess these patients in our clinics? Well, traditionally, there have been 3 ways to that intake process. Paper questionnaire before the patient sees the clinician. So we might hand it to them in the waiting room as part of the forms that they're filling out. Conversations when discussing their treatment options with their clinician. And outside of those conversations, there are publicly available data sets that give a general context to where a patient lives and works and what their environment might be like. However, this last type of way of collecting information is not patient-centric. It does not take into account the patient's personal preferences or life experiences. So with that, if you can go to the next slide, Dr. Schultz. Actually, one more slide. And one more. Thank you. We come to how do we then integrate this information that we may have taken the time to obtain in the clinic visit, and how do we get that then into the medical record? So with the next slide, we'll go into what are some ways that what's happening in the clinic with this information. So regardless of the 3 methods, whichever way the practitioner has decided to collect the information, whether it's by paper, conversation, or through these data bases, it needs to get into the EMR once it's been collected. But as I say, in the clinic, there are very real challenges. So workflow is a huge one. Who will be designated to collect this information? Which staff will be required to now take on this extra responsibility? We're looking at interoperability. Where does it go into the chart? Where is that space for social determinants of health, for green spaces, for outdoor recreation time? There isn't really one built in at the moment. And then we lastly go into the coding standards. As much as providers want to be able to have a more holistic visit with their patients, many of us struggle simply because of the reimbursable amounts of the visits. We have to be very creative sometimes in how we bill for things and how we're able to bundle them up into consultation visits, into the conversation. And so there are no clear coding standards currently that allow for exposure to green spaces and nature care to be reimbursed. Because of these challenges and the fact that there's no universal process to this intake process, clinics can independently decide if and how they will address this. And some do not. Some simply don't have the resources and are stretched too thin to really begin to dive deep into this. Next slide, please. So there is a crucial need for IT support, clearly. And we start with looking at this graph, the evaluation model for factors influencing NBHI impacts on clinical workflow. You can see in summary between and under resources, our intake form and EMR integration technology begins the intervention cycle with tailored patient-centric prescriptions. So we're really looking at the needs of the patient in front of us. Going towards context and reasoning, we will be working directly with staff. So it's very important to incorporate the staff into the conversation along with the patients. How will we be doing that? We'll be working directly through interviews, etc., really trying to determine the needs and barriers within their population and their communities, and using this to then adjust the implementation. Internationally, we've seen these programs adopted and examined by countless other countries. Our work is to bring the US system specifically designed into this system that's being incorporated into other countries. So more recently, if you've seen the news, our friends in Canada are now prescribing evidence-based prescriptions for nature-based care. Other examples, since the 1980s, Japan has incorporated this as a cornerstone to their primary care prevention model. New Zealand, our friends in the NHS, part of our working group, we have colleagues from Wales, from Scotland. This is being heavily looked upon as part of how can we incorporate this. So specific to my background, which is oncology, I know from the proposals that I've been invited, along with Dr. Schultz, to develop within here in the United States, it is beginning to take root. Cancer centers, large cancer centers, have approached us with interest in how their patients can benefit, how their staff can benefit from green spaces or nature-based care. Working with those institutions is going to be a large project, but it's going to be one that will benefit entire communities. Looking at the outcomes at number 4, by using already existing technology. So we're really not reinventing the wheel here. There are things like SMS, fitness trackers, etc., that help to really close that communication gap, that communication loop, and that will carry with the patient back to their next encounter. And continuing the evidence-based research is important as we go along. Collection of biometrics and other metrics that show the effectiveness of these interventions on mental and physical health are paramount. Next slide, please. So when we're looking at the ecosystem of care, and I again invite you to think of this not just as the patients, not just for the staff, not just for research, but that the entire healthcare system as an ecosystem where the clinic is part of their community and that community is being affected by their greater environment. So with this in mind, I ask you to think of the impact of having nature-based care integrated into our EMR systems and into the practice by allowing for inclusion of non-clinical community resources. And by that, I mean looking at certain communities of color. For example, the barbershop is a place where many African-American men begin to have conversations, and the barber is actually a resource, and in some places are being utilized as a resource to get the information out to the community onto where they can go for help. What allies do they have that they can look at to better their own health? In other places, libraries. Community libraries are hosting events and information sessions and allowing even private encounters with practitioners to get resources. So this begins to allow for an idea of inclusion of those non-clinical community resources. We're looking at expanding patient clinical referral systems. There are many ways that the patient is seeking out help or advice outside of the physician's office, and being able to pull that in and get a clear picture of that person's resources and what's available to that person is very important. And much of that is going to happen outside of that particular office. In terms of technology integration, our tech solutions and research is really striving to provide a dynamic, creative solution to some of the most pressing, wicked problems facing healthcare today. So continued effort to embed those NBHIs into the clinical workforce by leveraging health technology solutions improves patient-centric care and worker-centric care, addressing the issues and the gaps that exist within the clinic that make it difficult to truly take an ecosystem approach to care. Going to staff well-being, we know particularly frontline workers who have been so impacted and continue to be impacted by the waves and surges of COVID-19. Colleagues of mine have expressed, from physicians to nurses across the board, how they feel about they're in moral distress. There is a call to action to help relieve the amount of stress that is put under the frontline workers. This is not a silver bullet, but this is a way of beginning to shift the paradigm. And it calls for technology to step up. Once people begin to feel the effects of green spaces, of nature-based care, and they begin to feel an appreciation for how that can better their life, their well-being, then they begin to promote interest into the environment. We can no longer ignore climate changes. We can no longer ignore the social determinants of health. There is an interconnectedness that must come down from abstract thinking now into the way that we live our lives, even into the clinic and the doctor's visit or the healthcare provider's visit. Next slide, please. So what's next? Dr. Schultz, I'll let you take that.
So thank you, Millie. And I think one of the fantastic things that we start to look at when we look at this entire field are the number of opportunities for us to be having these creative dynamic solutions, reimagining the use of, in some places, very commonplace technologies to be bespoke, customized solutions for our healthcare system. It's not enough to just say that nature-based health interventions are positive. We know from the literature and all the findings surrounding that it is very positive for both the healthcare workers and the patients. But if we don't find solutions to the workflow within the clinic itself. It becomes a burden and a barrier that eliminates the possibility of this being really leveraged as a great opportunity. And so one of the things that we are actively working on is testing out a number of these technologies and a reimagination of what these nature-based health interventions can look like. Working with clinical partners across the United States, we are having a great opportunity to really re-envision what the intake process looks like, what it means when we start to ask patients a question about how they spend time in nature. Do they like going outside? Is there a particular leisure behavior that they really enjoy doing? And thinking about how we use then those patient preferences as a precursor then to the generation of these tailored prescriptions, of really thinking about the idea of how isolated our patients feel, not just in a time of COVID, but often times of feeling very ostracized through their healthcare process. So how do we make them feel like they have an equal voice in the clinic space? Well, leveraging communication loops is one of the ways that we are addressing that by allowing the patient to have interactions back and forth with their clinical team, so that as they mature through their prescription, maybe they can walk more than the 3 times a week that they were doing in the park. Maybe they need something a little bit more challenging, or maybe a different health concern has arisen while they were doing this other. It allows them to have that communication back to the clinic. And that also means that things like an occurrence of multiple chronic illnesses emerging in a body can also be addressed appropriately by the care team, because these things are better tracked by the patient. There's a better awareness of when these illnesses may be manifested. And so the quality of care that we're able to deliver to patients by closing this communication loop is absolutely fantastic. And when we think then about then how we begin to adjust this for our healthcare workers, carving out spaces, whether that's an indoor space that is modified with aspects of biophilia, so bringing in the sense, the sounds, the feels of nature into the workplace in a sanitized way that meets standards of these healthcare clinics. We're actually developing garden spaces for these healthcare workers to take moments of respite in the same way that we've normalized smoking breaks for all of these years, taking a garden break, taking an outdoor break, where they can sit for 5, collect themselves, de-stress, recenter themselves before going back in what is often a very chaotic, stressful environment. Means that perhaps fewer mistakes get made on the job. You have better retention rate with your staff. You have better positivity among your staff. And all of that has a cascading effect into the overall quality of patient healthcare that we're providing. And so whether it is looking at how we can begin to change the paradigm around coding for billing purposes, or really thinking about this clinical workflow, what the two of us are working on is really making sure that it is not just another burden. It's not another checklist item for our healthcare providers, but really finding bespoke, customized solutions for integrating the idea of nature-based health interventions, utilizing these new tech opportunities so that we can begin to shape so that we have a stronger ecosystem of care, so that as more of these pandemics and more changes with climate change occur, we have systems that are ready for the next wave of grief that is going to hit them, rather than constantly being on the back foot.